What do you think some of the biggest challenges are going to be as you implement EHRs?
Um, I think in general, the first big challenge is cost. Once you get past that hurdle, then you have a whole group of people, not just one or two people, but a group of people, especially in a big practice, that have to have a whole mind shift, from paper to actually using their electronic records. So I think getting up to speed with using it once you've implemented it, getting the people who are coming along into the future kicking and screaming to catch up with those who have been waiting for the EHR all along is going to definitely be a challenge. And I suspect that in some practices they may lose some people. Just because the staff may not be willing to do what it takes to do, or the discomfort that comes with making such a big culture change, the culture of paper to the electronic culture. So those, I think, are the two biggest ones: upfront cost, and then just the whole culture change and getting from here paper to their electronic medical records.
What about some really specific things? I mean, just in terms of like practice operations, like what do you think will be hard, down at a very nitty gritty level?
Well, in a practice like mine, down at a very nitty gritty level, are the medical assistants who bring the patients, who check the patients in and bring them back. They're going to have to get used to carrying a tablet. They already have a thermometer in their pocket. They may or may not be helping in a pediatric practice the mom carry either the baby or the baby's accoutrement. And then now they have to have this tablet they're going to have to carry around. And I think it's going to take a little bit for them to get used to, let mom carry her own diaper bag. It's nice that you can do that, but you've got to carry this because this is what's going to help us get the information in. So that's one of the very specifics that I think is going to be a big challenge. Another specific that I can think of is just the fact that everybody, even no matter how tech savvy you are, is going to be working a little bit slower when they first make the transition from paper to electronic records. So I mean, we have one partner, Dr. Faruqi, who's like, yes, let's do it tomorrow. He's very computer savvy, very tech savvy. Even with Dr. Faruqi, I expect that there'll be a little bit of a downtick in his productivity in the beginning. I expect though, compared to some of the other partners, he's going to quickly get back to his productivity and go above. But that's, I think, one of the big things for the physicians or the other clinicians is getting used to the fact that it's going to take you longer to do in the beginning what you used to do.
What about things that you're not really anticipating any difficulty with? Like, what do you think will be sort of a light lift or easy to accomplish through implementation?
I think that one of the light lifts is going to be the scheduling, because we also already use computerized scheduling. So I think that's going to move pretty smoothly. I think the other thing that's going to be a light lift is questions for the physicians. When you get a phone call from a mother or an email from a mother, right now, those questions are sitting in our office until we get back to them, unless it sounds emergent, in which case the staff will interrupt us. I think we're going to be more efficient with those kind of things, returning phone calls, seeing labs very quickly because they're going to drop right onto our desk, or specifically our laptop, so that we can see them in a more timely manner. And I think that's going to be kind of an easy, smooth sailing.
Could you just sort of paint a picture of what you expect daily operations to be like about a month after implementation, and sort of contrast that to where you guys are now?
Sure. What I think is going to happen about a month after, I think about a month after, most of us are going to be comfortable with using our tablets. I think the staff, meaning the medical assistants, will have gotten comfortable with their tablets and entering things directly into that as opposed to on paper. So I think what we're going to see a month from now is us doing the same things, but as I've said several times, doing them more efficiently. Day 1, day 2, day 5 after we go live, I don't think so. I think it's going to be a learning curve. But I think that by a month, we'll pretty much have an idea of what we're doing, and we'll all be able to see that this is making our practice more efficient and making our lives and our patient lives better because of that. When you compare to now, one of the things that happens now is sometimes you need a chart and it's not in the chart rack. So you've got a doctor on the phone, you've got a pharmacist on the phone, and you need to talk about something that's specifically in that chart, and now you have to send someone looking for the chart because it is either on someone else's desk, it's in the referral stash, it's in the lab's file or something like that. That won't happen. And so that's one of the contrasts I see. In the future, a month from when we go live and definitely going forward, when we need a chart, it'll be immediately available. That will make us much more efficient. That will give us much better patient care.
Based on your planning and everything you've done to get to this point, do you have any suggestions, recommendations you'd make to other practices, whether they're in your specialty or not, as far as just getting to where you are now to the point of being ready to implement?
Yeah, I think one of the most important things I'd say is once you've done your due diligence and you've decided you're going to have an EHR, then I think you sort of need to pick a date and say, okay, I'm going to do it by this date. Because if you don't, you'll keep getting bombarded with different platforms, different options of how to do this. So once you've decided, yes, I'm going to have electronic medical records, the next step is decide who your carrier is going to be, who you're going to do clinical works or whatever. And then set yourself a date. Say, no later than this date, I am actually going to be doing it. Now, even if you're not really live that date, that gives you something to work for. Because otherwise, you could keep researching and researching and researching, and it'll be another 2-3 years from now. So it's make the decision to do it, then pick a date that you want to shoot for as your implementation date. I mean, in our practice, we said we wanted to go to EHR no later than 2011. Well, it's the beginning of 2011, and we're just about to go live in about a month.
Great. Thank you.
Mm-hmm.